In the previous video, we will told that how to examine a rape accused. In this video, we told how to examine a rape victim. So this type of letter you receive from the police station, that the MSBB meets medical super of that hospital, then address, then reference from the police station, police case number is here. Subject is prayer for holding medico legal examination of victim, namely Mr. M, year 25, daughter of XY, Rampurhat, ward number 2. The main letter is that brief fact of case that on 11th July 2020 received a written complaint from Mr. M, Rampurhat, ward number 2, that since last 2 years that accused person named S. Kumar is pursuing her getting married and exploited her physically. Later he came to know he dubbed her. He threatened her with dire consequence. Over this complaint, the case has been registered, mentioned above, being ensured that Inspector in charge Rampurhat Police Station SIP thus look up the investigation. So during investigation in this case, that it is examined. I have examined the complaint that it was arrested that victim was raped by the accused S. Kumar on several occasions with false assurance to marry her. Okay, then hence, for the interest of investigation medical examination, the said victim is urgently required over the following points. What are the points? That whether she was subjected to sexual intercourse or not, whether by her hymen is intact or not, then whether any mark of injury could be detected on her private parts or any other parts of her body or not. Then point 4 is any foreign body could be detected on her private parts or any other parts of her body or not. Then vaginal swab of victim may kindly preserve if required, and any point of interest with this investigation. Then the SI of police station. Okay, so now we start the reporting of this case according to the examination. So this is the format of the examination report of rape victim, that it is confidential, then memo number, then the department or the hospital, then what is the findings. We have to write that date of examination, reference, address, age, sex, brought and identified by examination, consent, mental status, identification marks, then the height, weight, BP, pulse rate, etc. Then the dental examination, then menstrual history, extragenital injury, breast, abdomen, then genital injury or genital examination. Here is the genital organs you have to examine, then the material preserved, then opinion, and at last signature. Okay, so let's start. At first memo number, suppose 005. Okay, then date and time of examination. It is the 2 days when we record the video. It is 29th December 2023. So it is not according to the question, but means according to the question it is too late, but the date of examination is the current date. Okay, but according to the question we have to write different date, because the examination is done on this day or next day or within 48 hours or 72 hours. Okay, but we write here the today's date, means so 29th December 2023. Okay, then reference, it is the reference. Okay, so we write as it is. So here it is the whole reference or case number, then the address. Okay, so the address is Rampurhat, ward number 2. Then age is 25, we know. Sex female, brought and identified by the SI of Rampurhat police station. Okay, SI of the SI of Rampurhat police station. Okay, then examination in presence of the staffs of the Rampurhat medical college. Okay, so the examination in presence of staffs of Rampurhat medical college. Okay, then consent. Then consent is mandatory for examination of a rape victim. It is not necessary for the examination of a rape accused, but in case of rape victim we have to take consent. So the consent, so the written consent is taken and enclosed. Okay, then the mental status. Mental status is alert, conscious and cooperative. So the mental status is alert, conscious and cooperative. Then the identification marks. So as per examination we see the identification marks. So one pin head size black mole over right forehead, 2 inch above upper margin of right eyebrow and 2.3 inch lateral to front midline. Okay, then pin head size black mole over position aspect of middle ear, posterior aspect of middle ear lobule. Okay, so these are the identification marks. These identification marks are very important for any examination. Now the general examinations like height, weight, BP. Oh, then height suppose is 5 feet. 5 feet. Okay, then weight is suppose 58 kg. Okay, 58 kg. Then BP is 120 by 80. Then pulse rate is about 80 per minute. Then respiratory rate is 18 per minute. Then temperature is suppose 98.41. Then scalp hair is 15 inch straight and black. Okay, so 15 inch straight black. Then is axillary hair suppose 1 inch black in coats. So axillary hair is 1 inch black coats. Okay, then dental examination. Suppose the dental examination is 2 1 2 2. Okay, here also 2 1 2 2, then 2 2 1 2 2 1 2 2. It is her dental examination. Then total is 28 and all are permanent and spacing is not present, means the gap is not present. So 28 all permanent and spacing is not present. Okay, next is the menstrual history. So in menstrual history we see that last menstruation is held on 3rd December 2023. So we make it clear that we don't follow the dates here according to the question. The question is for just sampling. Okay, so here we put the dates according to current situation, as it is a recent case of rape. Okay, then so the last menstrual period is on 3rd December 2023, regular in every month for 4 to 5 days and sustain 4 to 5 days sustainability, and it is painless. Okay, this is the menstrual history. Then examination of external injuries. So we examine her and these are the findings. Okay, at first a bruise over 2 by 2 inch over the ventral aspect of right forearm, 2 inch proximal to right wrist joint. Okay, then NSA means nail scratch abrasion. Okay, then nail scratch abrasion over 2 inch by 0.1 inch over left cheek, 1.2 inch left from the anterior midline. Then again a nasal scratch abrasion 3 inch into 0.1 inch over medial aspect of right thigh, 3 inch above right knee. Okay, Then a bruise of 2 by 1 inch over medial aspect of left thigh 5 inch below left anterior superior iliac spine. Okay. Then bruise over 1 inch and 1 by 1 inch over inner aspect of upper lip. So these 5 finding of extragenital injury we find in this women. Then the examination of breast. Okay. Then we examine the breast and we find this finding that a one bite mark of 2 inch into 0.2 inch over upper inner quadrant of right breast, 2 inch lateral to midline and 2.5 inch below medial end of the left clavicle bone. Okay. Then the examination of abdomen. Okay. So these are the abdominal findings, that one bite mark over lower anterior abdominal wall measuring 3 into 0.2 inch in right side, 3 inch right from the front midline and 2 inch above from the right anterior superior iliac spine. Okay. Then the genital examination. In genital examination, it's labia majora. Okay. So labia majora labia majora is healthy, fleshy, and there is no injury. Labia minora is healthy, dark, thin, and there is also no injury. Then forceps, it's obliterated. Then we come to the hymen. So in the hymen we find that multiple triad at 4, 6 and 7 o'clock position with reddish inflamed margin. Okay. Then the examination of vagina. So in the vagina we found that a dark reddish bruise measuring 1 by 1 inch over upper 1/3 of the posterior vaginal wall. Then the vaginal discharge or bleeding, there is no vaginal discharge or bleeding. Okay. Then X-ray is not advised as not asked for, means X-ray is not advised. Then material preserved. So now in the material preserved, that vaginal swab and smear. Okay. The swab from the bite marks also are collected, sealed, signed and handed over to the escorting police officer for transmission of FSL, means forensic science laboratory, for detection of any spermatozoa present or not. Okay. Then the final one is opinion. So we give opinion according to the question asked. Okay. The queries from the police station. So we see that what are the queries from the police station. The first query is whether she was subjected to sexual intercourse or not. So according to our examination we give the opinion. So according to our examination we found that probably she is going to a sexual intercourse. Okay. So we write in the opinion as number 1. So our first opinion is, considering the presence of injury over the different parts of the body, possibility of sexual assault cannot be ruled out. Okay. Means he probably going a sexual assault, and however it is confirmed by after receiving report from FSL. Okay. So it is our first opinion. Then next query is whether her hymen is intact or not. We already mentioned about the hymen in this report, so we write that as noted. So second report is as noted. Then next, whoever any mark of injury could be detected on her private part or any part of her body. We also already mentioned in the report where the injury we can found and where not. So here we also write that as noted. Okay. So 3 is also as noted. Then next is whether any foreign body could be detected on her private part or any part of the body. We could not found any foreign body, so we write that no foreign body detected. And in the naked eye, okay, because in the naked eye you cannot find any foreign body, but in the FSL report you can find any foreign body, okay. So here we write that no foreign body detected in the naked eye examination, okay, naked eye, and final opinion can be given after receiving of FSL report, okay. Then the vaginal swab of victim may kindly preserve. We already preserved it, so write that already preserved and sent to FSL. And after that, any other point of interest with this investigation, we have no other such point of interest, okay. So you already write that preserved and send it to FSL and no other point of interest. So that's all done about the reporting, and at last the signature. So here is signature or name in block letter or seal, okay, by the doctors. So let's revise that. At first the patient details here, okay, the patient details here, then the general examinations here, dental examination, then the menstrual history, then extragenital injury, then breast examination, abdominal examination, then genital injury, okay, then material preserved, then opinion, and at last signature. So this all about the examination report of a victim.